Hello, Kidney Warriors! James here from Dadvice TV, your online kidney health coach, and this is Dadvice TV Live. Now, for those of you who are joining us for the first time, and we always get new viewers every single time we're live, welcome. Great to have you here. You're going to find Dadvice TV extremely positive, full of energy, and helpful for those living with kidney disease, or maybe you know someone who has kidney disease. Now, if you are new, let me quickly introduce myself. My name is James. I'm the host here and the founder of Dadvice TV, and I too am a kidney warrior. I was diagnosed about 3 years ago with stage 5 kidney failure. I did not realize my kidneys were going downhill until I spent a week in the ICU, and that's when I first heard the words kidney disease. I was like, what? Holy cow. Doctors wanted to put me on dialysis, but I did the things we're going to talk about today. I took control of my kidney disease. I became my #1 advocate. I spoke to doctors. We started making changes to my lifestyle. I started eating better, getting my blood pressure control, and all sorts of things we're going to talk about today. And my overall health started to improve. And as it improved, you know what else improved? My labs and my symptoms, boom, I kicked them all to the curb. And now I'm back to feeling great, got a lot of energy. And people who see me on the street are surprised to learn that I suffered kidney failure and was told I'd have to go on dialysis. Okay, so how can you learn some of the things that I learned? I learned it the hard way. So we're going to teach you about those today here on Dadvice TV with my guest. Welcome back again. I think this is his 5th visit here to Dadvice TV. Please welcome Dr. Gibney. Hey, Doc.
James, thanks very much for the opportunity, and I can't tell you how much I enjoy talking with you. You're the real perfect role model for not waiting until the end to get everything put together, because what we're going to talk about today is if you can identify the fact that you have a, a mild loss of kidney function or protein in your urine or a moderate loss of kidney function or a moderate amount of protein in the urine, or if you have severe loss, there are many things that can be done to push it back up. But our goal, I'm on the faculty at the University of Texas Health Science Center, San Antonio, and I would tell you that after 14 months there, the people that we've had the opportunity to coach and train so that they can do their own self-care, so they can have control of their health, and using some of the brand new medicines that are available, we've had zero new patients start dialysis. So the opportunity going forward is how to preserve kidney function, and that's the story we're going to talk about today.
Yep, and I'll tell you, I wish I had like some fireworks I could turn on that come on the screen. I'm going to have to get them every time you talk about the people that you've worked with. Still, none of them have gone on dialysis, which is just amazing. A lot of people don't realize that you can live a pretty much a normal life if you catch kidney disease early enough and not have to worry about dialysis. And I'm one of those that went all the way to the edge, but was able to regain enough that I am living life, loving things. I'm getting ready for a big move, relocation and stuff. I've got lots of energy. I'm packing, I'm working, I'm doing stuff. I feel great. My kidney disease are not causing any issues for me or slowing me down. So how do we get started? Or let's just say, what are some signs, you kind of mentioned a few, that people should realize or recognize, this is something serious? Because kidney disease is that silent killer. We usually don't see symptoms until it's close to too late.
Our opportunities are so great. And as James mentioned, one of the tremendous difficulties is, if you break your arm, you have pain. If you have gallbladder trouble, you have pain. Kidney disease is silent. And so because of that, seeing your doctor once or twice a year and having them draw some blood work to look at your kidney function and also getting a simple urine sample and to see if you have any protein in your urine. Those are two very simple tests, and also obviously checking your blood pressure to make sure your blood pressure, your blood sugars are okay. And what I would tell you is then we, the medical profession, don't do a good job of identifying people upstream, meaning that you've probably heard that there are like 5 categories of CKD, chronic kidney disease, one, two, three, four, and five. And we've kind of focused our attention for the last 50 years on four and five when it was at a point where you were getting ready for dialysis. We've radically changed the approach to move up to 1, 2, 3A, and 3B, and early 4. And guess what? There are brand new drugs that can really stabilize kidney functions. We've talked about those before. The SGLT2 inhibitors, drugs like Farxiga, Invokana, they not only, it's a simple diabetic tablet. However, it preserves kidney function and in addition makes congestive heart failure much better. So a diabetic tablet, I love when I talk to patients to say, this drug does 3 things. It's a diabetic tablet, mild effect on blood sugars, but it preserves kidney function and it also makes congestive heart failure better. And then there's another drug that we just started using called finerenone, and I had to practice for about 3 months saying the word finerenone. So good luck on that.
Hey,
But
I still have trouble with atherosclerosis, and I think I might have said it right that time.
So anyway, finerenone is a aldosterone receptor blocker, meaning that there's a renin-angiotensin system in the body, the kidneys, and so this is a different pathway than the SGLT2. And so we've just started using it, but it's well tolerated, just like the SGLT2s. It's another component of the pathway to preserve kidney function. So there's a massive number of new medications available. Highly recommend you talk to your doctors. If you have a primary care doctor, talk to him and say there's these new drugs we've heard about. What do you think? Would they be something I should consider using? The same thing if you have an endocrine diabetes doctor, if you have a cardiologist, if you have a nephrologist, ask all of them. Say, this is a brand new drug we're hearing about. It's been around for 2 or 3 years, very well tolerated, and really the first drug in 50 years that has a powerful effect to preserve function.
Yeah, and I asked people in the chat to let us know when they were told they had kidney disease, kind of what stage they were, and the majority were stage 3 and 4. I haven't seen anyone say anything early, like stage 2 or even stage 1, which kind of fits what we hear from everybody. It's always close to the, pretty far along before doctors or patients learn about it from their doctors.
And what they're saying is absolutely true. And our approach has been that we developed a protocol and a way to identify, you've heard of AI and analytics and using computers to track people. So that what we do is we're following about 14,000 patients in our outpatient system. And so we can identify somebody that's at risk that I talked about before and said, if they have a decrease of function, if they have a mild to moderate to more substantial amount of protein in the urine. And the idea here is, as you know, and I want to talk about the people because, as James said, the people are the most important. And this phrase that I use all the time is the person with the problem must be involved in the solution. So if we forget to tell you that you have protein in your urine, if we forget to tell you that there's a mild to moderate loss of function, so the people I see, and I can tell you this is universal, the first time I see them, they come in, they've been told they have kidney failure. So basically, there's a spectrum of fear, terror, anxiety, and they're all terror. And I say, what's the matter? What is wrong with you? And they said, well, they said they have kidney failure, and I guess that means I have to go on a kidney machine. And I go, no, let's back this up. The truth is you have a mild loss of function, and we have medications that can stabilize it. And in addition to that, and this is really powerful, we only go down to a GFR of 25 at this time, or a percent kidney function of 25, just because the studies that have been done did it in that manner. We wanted to make sure that what we were doing was consistent, and we got a good result. So you say, well, what about the people that you see that are below 25? Well, whether you're above 25 or below 25, we very actively get you involved and give you a piece of paper with your homework. And I can tell you 99.9% of the patients jump at the chance to have homework. And the homework's real simple. The typical patients we see are typically, not all, but a high percentage, have diabetes, hypertension. So their homework is to check their blood sugars and their blood pressures at home at least twice a day, or more often if needed. And then they've taught me that the spiral notebook is the gold standard. Everybody has a spiral notebook they write their numbers down in. They also have to bring their medication bottles, and the bottles are important. And it's kind of a pain to bring your medication bottles, but I then know exactly, because I'll say to you, what do you take? How do you take it? And why do you take it? And when we first start, maybe you don't know exactly, but by the time we're done after a few sessions, you know better than I do exactly how you take it, why you take it, how you take it, and it makes you a much more powerful person. And in addition to that, patient advocate. And this is a critical component, because if you're sitting in the exam room all by yourself and you're terrified and fearful, that doesn't really help anything. You bring your daughter, your wife, your cousin, somebody in your family, and they can then listen to the story. Some people's stories are relatively simple and say, I have high blood pressure only. Some are much more complex. They have high blood pressure, diabetes, heart trouble, kidney trouble, uh, and therefore they're on a lot of different medicines, and you have to get them all to work together. So, uh, coaching and training the patients so they can take control of their health. When they come in fairly quickly, they run the show. They're telling me what their numbers mean. They're telling me what their medications are for. And guess what? They're preserving kidney function. We give the patients a graph that shows how their percent kidney function GFR is, and they know the numbers before I even show it to them. So it is pure joy on my part to be able to listen to the patient. The patients are bright, they're good people, and it's pure joy.
Now I want to back up just a moment. A lot of people are asking, "Hey James, what are the names of those drugs?" And I posted them in the chat. I'm going to post them one more time so people can see them. We actually did a conversation for everyone out there who wants to learn more about these drugs. We had a broadcast with Dr. Gibney about them, and we went into a lot of detail on the different drugs there. So if you go to dadvicetv.com, the website, you click on Dr. Gibney's face on the homepage, you'll see those videos, and you can go watch them all really easy. Someone had asked, and I believe this is true. One of the side effects of one of those drugs, or some of those drugs, is weight loss. Is that correct?
That is a true statement, and it's one of the drugs I didn't mention, but it's part of what we do. The SGLT2s like Farxiga, Invokana, they have some mild benefit to weight loss, altering metabolism. The really powerful ones are the GLP-1, and examples would be Trulicity, Ozempic, are both GLP-1s. And I would tell you that in addition to dramatic improvement in blood sugar control, you have a significant decrease or loss of weight using those. And I would further tell you to keep watching, because we're going to keep you abreast of all the new drugs that are in the pipeline. There's a drug. There's a drug called Zer, and these are all impossible to pronounce. But
Yeah,
but
they got to make up new names that no one uses. So just randomly picking the letters that are hard to use in the alphabet.
but I would tell you, and this is again a GLP-1, kind of the next generation, has not been approved by the FDA yet, but it will be approved shortly, and it's called Zerpeptide. And Zerpeptide is even more powerful, at controlling blood sugars and losing weight. And so we finally figured out that the problem with the fact that there's an epidemic of people being overweight in America is a metabolic problem. And if you can fix the metabolic component, you will lose weight. There's a huge number of drugs coming in on this pipeline, on the endocrine diabetes pipeline, and you should be very optimistic and excited about a lot of drugs to help you with your lifestyle changes you make to make sure you stay healthy.
And for these drugs, if someone's a type 1 diabetic, are some of these drugs helpful for them, or are these more for type 2 and people who are not type 1?
There's limited use at this moment in type 1, but that's just because that's the way it's sort of evolved. And I think with time we'll find out how powerful they can be for type 1 also. But at this time, they're not exclusively, but they're primarily oriented to type 2 diabetes.
And at what stage or GFR are these drugs um, helpful? Is this something where it's stage 4 or maybe even earlier?
Yeah, we followed the DAPA CKD study, and the GFRs anywhere from 75 down to 25. So it's a wide range from stage 2 all the way down to the early stages of 4. So you have
Awesome.
a lot of flexibility in using those for a lot of patients, and that's why I say when we do this, we lock them in where they are. Now, I can't make your kidney function better, but what I can do is preserve kidney function. And if you preserve kidney function, we've changed our clinic for one of where people were sad and were depressed and were struggling terribly to one of joy and optimism. And that's exactly the way medicine should be healing. How do we help people get healthy again?
100%. I, all of us patients, we've been there. You're, you're told kidney failure. At some point, you understand it. At first, my doctors were saying renal failure. I was like, what the heck's a renal? I don't know what a renal is. It made no sense to me. And they were, what does a renal failure mean? Your glomerular filtration rate. Like, what the heck did you just say? And for us, it is confusing. It's overwhelming. It's scary because we go on the internet, we look, and what are the first things we see? All the big dialysis centers. And most of us know someone who is or was on dialysis, and they've shared their stories. So we're, it for us, it is a big emotional burden. And then you're thinking, can I work? How am I going to pay my bills? So much. So it is such a relief to hear you say that your clinic is a joy because you're actually helping people. You're not burdening them with all this negative outlook. You're empowering them. Look at that. I'm even using your word. You're empowering them with the knowledge, the attitude, because a lot of it is attitude. You got to know, hey, you can do this. And the skills they need to start taking control of it so that they're not sharing a dialysis story down the road. They're sharing hey, yeah, oh yeah, I've got kidney disease. Here's the medications I use. Here's what I do. I'm exercise, keeping my heart healthy. I know it's not my kidneys, but my heart's really important. And they're loving life, and like you said, you're bringing them joy and happiness. You're giving them a second chance.
So you take these people that we first see that are fearful, anxious, and then just basically terrified, and we reassure them. We say there's a lot of stuff we can do for you, whether you're mild, moderate, or more significant loss of function. We then say have to do the following. We say, okay, what about goals? What goal do you have? We ask them because again, and I should mention the fact when we see people, I always say to them, it's kind of funny when I say this to them. I say, I know I've already had a chance to review your medical records in the computer. Tell me who you are as a person. And they go, well, why you want to know? Why you want to know? And I say, well, because depending on who you are and what your passions and joys and what you're doing, it's important. If you're a grandmother, you care about your grandchildren. If you're a guy that's working, you want to be able to keep working. Um, a simple story, I saw this lady and I said, well, tell me about yourself. And she said, well, I'm a chef. I said, really? I said, what restaurant do you work at? She says, the Valero gas station. I said, really? So I said, what do you make? And she says, well, I make those damn tacos. I said, damn tacos. She says, yeah, they fly off the thing for lunch like hotcakes. She says, I wouldn't touch one of them, but the people just love them. And she says, I love my job because I got income so I can take care of my grandchildren.
Mhm.
That's who a person is. You're not a disease, you're a person. So, with that said, then what's your goal? And almost uniformly, they say, my goal is never be on a kidney machine. I said, well, you came to the right place because that's our job is to help you to try to preserve kidney function. And they say, oh, great. Can you make it normal again? No. You've had scarring from whatever illness you have that's caused some scarring of your filters. And so if we can just preserve it, we should be really delighted. Now we have to come up with a plan. And they said, well, I don't have a clue what to do. What kind of plan are we going to have? And we kind of walked through the basics with them. And with that plan, and James may want to comment on this, you may be able to do it all by yourself, but as you heard from the homework, having a patient advocate and keeping track of your lab work and everything, that's really a powerful approach. Um, the other thing that's important is do you want to form a team? Do you want to comment on your team, James?
Oh yeah, yeah. Well, so let me go back to the goals. First thing, setting the goals. Um, I definitely did not want to go on dialysis, and my family doctor was very supportive. The original nephrologist, no, she's like, no, 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 you need dialysis, and she said if you don't go on dialysis in 45 days, your wife will be picking out your casket. I remember that. My wife remembers that. It brought her to tears when we're sitting there in the ICU and the doctor says that. So I made a goal that I would get to stage 2. Now, is it possible? No. But I made it to stage 3. I got so close and I feel great and I am pleased with my results. But my plan was I was going to go as far as I could. And, that was my goal. Then my plan, how was I going to do that? My doctor worked with me. We broke it all down. I'm going to get my diet under control. I'm going to start exercising. I'm going to get my blood pressure under control. There were all these little tiny things that we set up as kind of like milestones. And I needed some learning. I was like, you know what we're going to do? We'll get my creatinine down. What gets creatinine down? I was so focused on the wrong things instead of, hey, look, your sodium's through the roof. Let's get your sodium down. We can do that now. Let's take care of that. Check it off the box. Let's get some success from all these easy, low-hanging fruit things. We did all that, and then I had to keep learning. And my team, which is who taught me all this and helped keep me on track, first of all, there's the obvious team, your healthcare team, all your doctors. And I picked one, my family doctor, not my nephrologist, to be my quarterback. I was thinking, big Seahawks fan. I know Russell left. Tear. But I was like, okay, I need a Russell Wilson for my team here. Who's going to be my Russell Wilson? It's going to be my family doctor. And I told all the doctors, tell him everything. He will tell me. Because it was difficult. The instructions were conflicting, and I didn't know. I just saw this doctor on Tuesday and then this one on Friday. They're telling me different things. What do I do? No. My team started with the healthcare team. Tell my doctor. He will make the call and tell me what to do. But that's the obvious part. The team also goes into the family. My wife, my kids, they couldn't be leaving Reese's peanut butter cups all over the house and things like that were just temptation for me and bad. They also had to understand. My kids had to understand. Daddy's sick. Daddy needs your help to get better. Daddy's not always going to be able to go out and do things. Daddy's going to get tired. And that was part of my team. So they knew when we went and we did things, I might have to sit down in the shade, have my water, and sip it while the wife and kids went on and did some stuff. Or I'm sitting and watching instead of playing with them at the beach as much as they wanted. But my team was everyone that I engaged with, including, for me, and this is probably unique, coworkers. I'm very transparent. My car says kidney disease all over it. Talk to me about it. I let my coworkers know, hey, I've got, things aren't looking good medically for me, but I am working. I'm not going to be going out to the bars in the evening, drinking and eating all that delicious bar food and stuff like that. So they helped me, and they helped make sure I'm getting up and I'm walking. I'm not sitting all day. So that's kind of my team. It was way more than what you really think of. It's everyone I interacted with during the day that could help me, that could support me, that could be a second set of eyes for me.
Now, as you can see, James is blessed with the fact that he is not shy, and he's very comfortable with people. And so I'd say to you then again, because this whole program is focused on the patient, also known as the person. And I would tell you, as a person, James had the huge success that he's described, but it's not unusual that you may see a doctor where he's not very supportive for whatever reason. You just don't click as far as personality. When you're trying to form your team, if your blood sugars are not as good as you'd like, get an endocrine diabetes doctor to help with that. They have a lot of really creative ideas. Same thing with the cardiologist if you have congestive heart failure, because as James mentioned, you want to keep your heart healthy. Also, you want to do a a nephrologist to help to see if there are some things that they can help with. But I think he's very wise when he says you have to have a quarterback. Go back to your primary care, and then with what I've said, if you need assertiveness training, call James Fabian, and he would be happy to teach you how to be.
So let me tell you, when I first started Dadvice TV, I was like, if you have problems, reach out to me. I'll get on the phone with you and help you talk to your doctor. And, of course, there's rules for doctors talking about stuff, but I had a number of people that took me up on that, and I would get on the phone and I would talk to their doctor and say, hey, here's what they told me. And I was like, here's what they need. They need to know what to do. Don't just say eat better. They need to know what to eat. They'd like to see a dietitian. They need a referral from you. And I would kind of get the conversation started, and then I would get off the phone so they could talk to the patient.
So by being assertive, you're going to find the doctors that you can communicate with. With that communication and relationships are terribly important. So if you trust the doctor and he trusts you, you then are beginning to take control of your health. And the control of your health is so powerful. You then get confidence, you then get optimism and hope. You realize that it's going to be okay, and that you can do the same kind of journey that James Fabian did, where he goes and stabilizes kidney function and becomes a lot healthier. So that's really a powerful, powerful journey. And then, as I said, you've got to do your homework. You can't come in with not knowing anything and say, well, you have to do everything for me. You say, no, I'll do everything myself as much as possible. But then they give you tools like if you need to see a dietitian, if you need to see a social worker, there are certain resources that you need that you don't have. So there's lots of stuff available. And the other final comment on this is collaboration. You notice that he got his doctors to collaborate, meaning that they were saying the same thing, so that you get a consistent story on what you're supposed to be doing. But I can promise you that if you take control of your health, if you get identified that you have some kind of mild or moderate loss of kidney function, you can be extremely confident that you can preserve kidney function and stay healthy.
And you mentioned one phrase that I want to emphasize, stabilize your kidneys. A lot of people don't realize that, and I want to emphasize that to people out there. If you can stabilize your kidney disease, where you're pretty much holding steady, you're got this GFR range, you're just hanging out in, that is great because you're not moving down towards where you need dialysis. And that's where I am today. My kidney function is no longer improving, but it's holding steady. I have zero symptoms. I feel great. That's fine. The difference between a 30 today or a 34 tomorrow is nothing as long as I feel great. So that stabilizing is success. And I don't want anyone to, um, you know, not celebrate that. I see a lot of groups where people will post on Facebook, oh, my GFR is still the same. It's staying the same. And they'll say things like, I feel like I'm not doing enough. It's like, no, you're stable. That's great. There's only one step better, and that's it going up. But stable is fantastic. It's so much better than it's declining. So celebrate stable.
When you see your doctor, again, there's a lot of things that you should be asking for. So, for example, um, remember the fact you're not a chair and you're not a table. You're a live human being. So, there's going to be, as James has said, there's going to be some movement in your kidney function, a few points up and down. But if the overall trend is the same, you're being successful at preserving kidney function. And so you can say to the doctor, if he can provide, like we provide graphs to our patients where we show them what their numbers are each month or whatever, how often we do lab work, and it shows you exactly what the trend is. We like the trend where there's a flat line of stable function, or if it's improving a little bit, that's nice, but we're looking for stability. What we don't like is where there's a continuous decrease of function downhill, meaning that to go down a little bit and then come back up, that's okay. But to go down continuously, that heads you toward a kidney machine, and we don't like that. The patients don't like that. Nobody likes that. So I think that being able to track, you can track it yourself at home and write the numbers down that you have every time. The GFR, write it down every time. The creatinine, GFR, and that'll tell you what's going on. So I again take command, and the same thing with your lab work. You only really need to track a few things, like your potassium. If your potassium is doing well, just keep track of it, and then you'll know what's going on. And if it happens to bump up a little bit, you can look at your diet and say, oh yeah, that's what it was, because you have control of that. Phosphorus is kind of everywhere, and so if your phosphorus is normal, that's a good sign you have adequate kidney function to control your phosphorus. In addition to that, hemoglobin. Hemoglobin is
Yes.
your blood count, and if your hemoglobin's normal, that's another sign that your kidneys must be working pretty well. And then finally, there's a thing on your electrolytes like sodium, potassium, CO2, chloride. CO2 is kind of your acid-base balance, like bicarbonate, and you'd like to keep your CO2 like 22 to 24. And there are medications where you can take bicarb to keep it there, and it helps to preserve kidney function, etc. But again, everything I'm telling you, you got to check with your own doctor to see if they're comfortable with it. Obviously, I'm very comfortable with it. I do this for a living every day, so it's pretty second nature. But what's even more important is the patients. They do it every day at home. They become smarter, brighter. They're good people. And I would tell you again and again, the only time I've ever had a problem is when a patient wasn't given adequate information. Nobody took the time to explain to them what was actually going on. And so you have to be assertive then and say, I don't have a clue what you're talking about. I need help. You can do it in a nice professional way. And if it looks like that there's a personality or whatever, then find a new doctor. That's okay. You're not there to help the doctor's ego. You're there to be healthy. And I can assure you, the doctors are busy enough that they want what's best for you also. The doctors are hardworking, good people. They care about people. They're trying to heal, and be confident that do what's right for you and your family.
Yeah, and soon I will be looking for a new doctor. 'Cause, moving to a new state, and I'm kind of looking forward to that. I like to do an interview process. I ask a lot of questions. No surprise. And I talk to them about medications. I'm looking for one that doesn't turn to a pill first, that has some focus on diet and lifestyle, but will use medication. And I found that in my current doctor, and it's great. He's like, well, he considers himself a coach, which is really a good part of it. He's coaching me and our family before kidney disease to live better, to make better choices, to develop better habits. And that has all done really well at helping with communication. We get to joke around. He knows that I absolutely hate getting on that scale every time. And he'll joke around about it, like, hey, maybe this will be the time you don't have to get on the scale. I'm like, yay! And no. But having a good relationship is great.
And I think you'll find that, as I said, relationships are important. When you walk in to see your doctor and you've got your spiral notebooks showing blood sugar, blood pressure, whatever you're tracking, if you've got your book that, or he has his book, or you're looking at your my chart thing to look at all your lab work, you already know your lab work before it's there. He's thrilled. He's delighted. He's absolutely a cheerleader for you. And the same thing with looking at your medication bottles to clarify things. Gee, I'm taking quite a few. Are there any of these that I could stop? So becoming engaged and involved in your care is so powerful and wonderful. The doctor will enjoy it. And I can promise you that when James finds new doctors in the new community he's going to, they're going to be thrilled to see him, because he's going to walk in and say, these are my problems, 1, 2, 3, 4, 5. This is what I'm doing for them. And I think I'm doing pretty good, or I'm kind of concerned by one thing. Can you help me? And they're going to say, wow, this is the best patient I've ever seen.
Now, there's a few questions here in the comments, or a few comments here in the comments. Susan had a great one. I'm going to bring this up here on the screen. She wrote, I feel like I've gotten more information in this chat than almost 2 years with my nephrologist. That is, so first of all, that's awesome, Susan. I am so glad it's so helpful. Though I'm heartbroken, but not surprised that your nephrologist has not been as helpful. That's one of those things we kidney patients got to strive to get changed. And I think it comes down, Dr. Gibney and I were talking about before the show, it comes down to communication. They talk over our heads with all those medical terms, and not enough of them come down to our level to explain things so that we understand, and really to answer all the questions we have, even those ones we don't ask, but they know they're there in the back of our mind. My doctor's really good at bringing up all those things as a question, so that it helps pull it out of me. But I love that. And then someone had asked, didn't I move? Yes, I moved not that long ago, but we're changing states, new job, and I got to start going into the office, and it's a long drive up to Detroit from Cincinnati. So we're moving up there, going north to the snow.
So the message everybody here should take away from this is, yes, you are good. Yes, you are smart. The fact that you go to physicians, it's an opportunity for them to say, these are the things you can do to stabilize and heal yourself. They should be very comfortable with all the things that, as you know, the human body is made up of physical, and certainly we're focused on physical. In addition to physical, there's the emotional, there's the mental, and equally, or maybe the most important, is spiritual. So if you feel that you would like to ask the doctor to pray with you for help with your difficult problem, be very comfortable saying that, because the spiritual component of your life is terribly important, and you shouldn't feel awkward or uncomfortable and say, "Oh my gosh, I might offend them." I can promise you, all the doctors are happy to do whatever it does to help you to heal and get well.
Yep. You are your best advocate. And every doctor I've spoken to, they love it when patients actually ask questions. Because they tell me the thing that kind of breaks their own hearts, the doctor's hearts, is when they give advice and it doesn't get followed. Or they make recommendations and they don't get followed by the patient. And when they see someone who asks questions, they know, "Oh, this person wants to get better. They're asking kind of how to do it, and they're going to follow this advice. They may not get it right the first time, but they're taking the right steps in the right directions. So they love it when you, the patient, are asking questions, asking advice, asking how, why, what, things like that.
I would tell you that to show you the humanity of what James is talking about, we care for a large Hispanic population in San Antonio. So one day I had a long talk with a patient and about his weight, and said, these are the things you have to do to lose weight, the typical, blah blah blah. And then he came back. It was either three or 4 months later, and he'd lost a significant amount of weight. So I went outside and I was very complimentary to the patient. I said, "Gosh, this is great," and I felt good that, gosh, I must have really done a fabulous job of whatever I talked to the patient about. And so we have a dietitian in our clinic that goes around also. So I was telling her the story. I said, isn't it amazing that I told him about all this stuff? So later on in the day, she came back and she said, it's not exactly the way you think. I said, why not? She said, well, the Hispanic people use what's called a botanica, which is like a Hispanic pharmacy. They have a lot of herbal things and a lot of interesting objects. So she said, what happened was he ignored everything you said and he went out and got some La Lengua de la Saguera. I said, excuse me? She said, that's known as the tongue of the mother in law. And that by taking the herbal, the tongue of the mother-in-law, la lengua de Saguera, he lost 15 pounds. It had nothing at all to do with anything I had said. So it was a great dose of humility to say, uh, maybe I inspired him to go to the Botanica to get something that would actually work. But
Yeah. Hey,
it shows you
he got the end results. He lost weight.
you have to have a sense of humor about what you do.
Yes, exactly. So we've talked about, making a plan, setting goals, making a plan, continue to learn, um, finding tools, kind of building a team that helps you in the building of the relationships. Is there anything else that's important in this, taking control of your kidney disease to help you get it under control?
And I would mention again, when I started in the outpatient clinic, basically nobody brought a patient advocate with them. Nobody. And we then had a intense program where we said, this is terribly important to have somebody in your family come with you because they'll listen, they'll hear the story, they can then take it home. Sometimes you hear what they suggest or recommend. By that I mean the doctor, and you can interpret it differently. So at home they can talk about it. And so and I'll tell you, and I've told this to you before, but I'll repeat it because it's true. The most necessary person, the male creature, does a lot of really fabulous things. However, if you said to me, how good is the male creature at first obtaining medical help and then following the suggestions? And I would tell you, not so good. And so having the wife or the daughter-in-law come with them is magical. Typically, what happens is if the husband or the husband comes by himself, he goes home and the wife says, "Well, what did the doctor say?" He said, "I was doing perfect and
All's
everything was
good.
good."
I'm fine. I'm keep doing what I'm doing.
And she says, "Well, that's good." Now, if she comes with him, then she finds out the truth that I gave him 4 or 5 or 6 things to do because there were a lot of things that he could do to stabilize his kidney function. And they were explained in a logical way to say this is why it's going to be beneficial and helpful. And that's just the way it is. And so I say to everybody, ex-wives, come, girlfriends, you name it. Women are very, very helpful in medical practice to communicate much better with. And then they're there so that when I say to them, well, tell me about your diet and meds and stuff, they're very helpful because they'll say, well, not exactly. I said, what do you mean? Well, he's not following your diet at all. Oh, well, that's a little different story. So I had one guy, and you have common sense here. So I had one guy that I was seeing, and he was eating 12 tortillas a day. And so again, with practice and time, you get to use some common sense. So I said, and I give all the credit to the dietary people. They're really fabulous. We have a meeting every day to talk about what we're trying to suggest or encourage. And so I said, well, how about could you go from 12 tortillas a day to 10 tortillas a day?
There
He
you
said, well,
go.
I could do that. I could do that. So I think there's a lot of common sense involved. Families are terribly important, terribly supportive. Uh, and you listen to the people tell you their story, and they're so powerful. Young mother, her goal is to see her children graduate from grammar school. That's how sick or that's how serious her illness is. Another grandmother, she wants to see her grandchild graduate from high school.
Mhm.
That's how serious the problem is. But those are tremendous. So motivation is huge. If you can find something, and that's that thing about relationships we talked about. If you can find something that builds a relationship, I'll give you one more story.
Yep.
I had a young kid came in, did everything wrong, was the worst patient in the world. This is the first time for me to see him. Diabetic guy, hypertensive, significant loss of kidney function, and his wife came with them because that's what we encourage. So I'm talking to them, and he doesn't want to talk to me, and he's just kind of ignoring me. And I say to the wife, "What's your name?" And she says, "Rhiannon." I said, "Excuse me?" She says, "Rhiannon." I said, "Can you spell that for me?" She says, "Yeah, Rhiannon, Rhiannon." I said, "Where the hell did your mother get that name?" She says, "Well, my mom was from the 70s, and there was this very popular group called Fleetwood Mac. And,
Yes.
and there was a singer named Stevie Nicks who wrote a song called Rhiannon, and it was real big, real popular. So she thought, well, I'll just name my daughter Rhiannon. So then suddenly he woke up and thought, gosh, this guy's a rock and roll guy. I might be able to relate to him. And so we developed a good relationship. He and his wife did all the heavy lifting and did a lot of things to change things. We stabilized his function and he got much, much healthier. But it was because of that connectivity. Now, did I know that that was going to be what was going to help us? No. But I was allowing he and his wife to tell me who they were.
Yeah, and Kelly shared what part of his motivation says he has to get to his son's first child at least. That's a growing. I want to see my kids grow up, get married, and mine are little. My son just turned 9 earlier this month, like a week ago, so very recently, and my daughter's only 10. So that was my motivation. I want to see them get older, get married, grow up, get a career, be there as long as possible.
So include that in what you're doing both at home and tell the doctor, say, listen, I've got to stay healthy. These are the things, if your passion is a 58 Corvette and you want to keep working on the car to keep it in good shape, well, then tell the doctor that. That way he'll know. For me, it identifies when I make without question, all people are unique. All people are special. And so, because all people are special and unique, you need to search for that, and you'll find it if you look for it. They're not a disease. And stay a person with your dreams and hopes and passions. you'll do well.
Awesome, awesome. Any other? So we're at about 10 minutes left. We're coming up to the ending. Any other tips or advice? And I truly agree that having hope, finding something that gives you hope, something to strive for, is really important to help motivate you, especially when it's late at night, you're watching Netflix, there's some Reese peanut butter cups sitting in a bag, just yelling your name, saying, "We're delicious." You need those things to help motivate you to not fall for the bad temptations, to stay exercising, on your heart medication, all that.
I'll give you one more uh, drug name that you haven't probably heard. It's called buneticide. Bud ESONIDE. Uh, budesonide is a kind of a modified steroid, and it's just been released for use with IgA nephropathy. So for people that have IgA nephropathy, you can go to your doctor and say there's a brand new drug called budesonide, and would that be something that would be potentially helpful for me? Because what they've done with it is used it to stabilize kidney function and decrease the amount of protein in your urine.
Awesome. People love it when you give out a new drug, and I appreciate that you spelled it because I typed it in to Google as you were spelling it and got it and put it in the chat.
So you're going to see a lot of new things coming up. But despite all the new drugs that are very potent and very beneficial, I would tell you the most powerful thing in the world is the patient. The patient and his family are everything.
Yeah. Now I'm going to get to a couple good questions right here. This is a very important one. Richard asked, could dehydration be a part of why his kidneys GFR goes up and down?
No question that volume is a big deal. And if your volume depleted, your kidney function can go up. If your volume overloaded, it can go down. And that kind of plays a big part in people that have fluid retention. And if they've got swelling of the legs or if they have congestive heart failure, if you're appropriately aggressive with taking fluid off to get your volume in balance, you can see some increase in your creatinine or decrease in your GFR. On the other hand, if you go the opposite way, if you back off on the drug and then the patient starts to get swelling in the legs or heart failure, your kidney function appears to get better. And I would call it's just either dilutional with too much fluid or it concentrates with too little fluid. So the idea here is to keep your fluid in balance. And if you, for example, a lot of the patients that we take care of, like diabetics, will have some autonomic neuropathy. And by autonomic neuropathy, I mean that, let's say in their legs, they'll have some pain or discomfort related to autonomic neuropathy, but also appreciate the fact that when you're perfectly healthy, all the reflexes work perfectly. So if you lay down, sit, stand, your blood pressure stays the same. All the autonomic reflexes automatically adjust for it. And so for a lot of the patients, we'll tell them, don't push the diuretic so hard that you have no swelling. A little bit of swelling, you can wear support hose, compression hose that come up just below your knee. You put them on first thing in the morning. That helps a lot to keep your swelling controlled. And so, yes, you're exactly correct that volume, and it's funny because it depends on who you are. If you're a kidney doctor, we're comfortable with the things changing. If you're a cardiologist and he's put somebody on a high dose of diuretics and it makes his kidney function worse, they'll become uncomfortable. But the nice part is where I am, we communicate very well. And he'll say, "Gee, I'm kind of concerned." I said, "Don't worry about it. It's fine. Uh, it's a little bit higher, but it's nice and balanced. So from a kidney standpoint, it's fine." So get the doctors to collaborate and remember to keep your volume, appropriate for your condition. And always talk to your doctors and say, what do you think of this? And we like a lot. I do this all the time. Is I don't like the patients going to the emergency room. Anybody that's been to the emergency room, you wait forever. You have to pay a ton of money, and it's a mess. They do a ton of tests and all sorts of stuff. I mean, meaning when it's needed, it's needed. But I always give them options. Like, let's say, for example, if I'm adjusting their blood pressure medicine, I'll tell them now, see what numbers we'll pick a number, and we'll say if it's above this or below this, you can go down or up on your medicine, as opposed to saying, well, it's high. What do I do? Well, he never told me what to do. The same thing with your blood sugars. If it's too high or too low, here's how to back off or to increase depending on what's needed. So I think educating the patient, always ask your doctor if you give you stuff, say, well, if this doesn't help, should I increase it? Because there are, for example, there's some medicines that you'll be on and you're already at the maximum dose, so you can't adjust those. But there's lots of them where you're started on the initial dose. There's lots of room to adjust up or down.
Yeah, and my doctor does that a lot with my medications. Right now, my most recent was for my uric acid. It's very high. He got me on some medication. It came down a little. We doubled it. Went down more, but not enough. So we went up another 100 milligrams, tripled the original dose. And I think next week I'll go get some labs, and I think it'll be within range. But it's good to know. When we discussed that in the beginning, we're going to try this. It may not be enough. Then we'll go higher dose. It still may not be enough. We may have to go higher, but let's see and ease into it. So we knew that going into it, which actually helped me not feel bad when I saw that it didn't go down the first time.
Absolutely.
Now, I'm going to pop up a couple questions because we're almost out of time, Doc. Fred
Okay.
in Pensacola, and I used to live in England Air Force, or Eglin Air Force Base, Florida, also in England, but that's in Louisiana. He asked, is a GFR the only true measure of kidney function?
The answer is that um, none of them are the true measure. The way I would describe it is that your creatinine is primarily a byproduct of your muscles in your body, and it adjusts for whatever size you are. So there's a normal range, and that's kind of your basic number to begin with. And there's kind of a normal range, and then if you're consistently above that normal range, then you should ask the doctor, what does that mean? Do we need to do anything? The GFR is actually a calculated number where they take the creatinine, they put it in this formula, and they come up with the GFR, or what's called glomerular filtration rate. When we're talking to the patient, we call it the percent kidney function because nobody understands GFR. So why say GFR? You say GFR, it's actually percent kidney function. Now, that's not exactly correct, but it's good enough for what we do. And so what I like the GFR a lot because I think it's a good sense. The creatinine, it's a hard thing when you say went up or down, is that good or bad? People understand percents. Percent function, if it's up, that's a good thing. If it's down, that's a bad thing. Our patients know absolutely, I can promise you that when it's the same or better, they're happy. And when it goes down, they don't like it. But they're reassured. Like I've talked to them about when we start Farxiga or Invokana or Jardiance, the SGLT2, I'll say sometimes there's a drop in function temporarily, but it'll come right back up. So I said, I'm warning you, don't become very concerned and worried about it because it's going to be okay. And then when they say, I know you told me not to worry. So, and then sure enough, it comes right back up and they're fine. So I think the more that you can share everything with the patient, the better. And it makes the practice of medicine and it makes the healing of patients so much more powerful when the patients are in the driver's seat, they have control, makes my job very easy.
Awesome. All right. Well, we are at the top of the hour, As always, these just fly by so quickly. Thank you so much, Doc, for being here and answering all these questions, sharing all this great information. I've put a link to the Doc's website, empoweredkidneycare.org, where you guys can learn more. There's actually a blog post about what we talked about. I'm going to add that as soon as we're done with the broadcast here into the description. So if you want to read more about taking control of your kidney disease, the tips, how to do it, and get even more information, you can go through to the blog. There's also a blog about those medications that Doc mentioned, which are great to learn more about and to talk to your doctor to see if they may be right for you. This is the last broadcast of the week. I will be back next week with more stuff. I can't remember what's on the agenda, but I'll be back next week. And Dr. Gibney will be back next month with even more great, helpful information. All right. Thank you, Doc. And thank you, everyone out there. I'll see you all in the next video. Bye, everyone.